My name is Caitlin Laidley, and I am in the Accelerated Nursing Program graduating December 2014.
And my name is Anne Makuna, graduating 2015. I'm in the pharmacy program.
And the objectives of our project today is to identify subjective and objective data for hypertension. Based on primary literature, recommend an appropriate drug therapy for a patient with hypertension, and create a monitoring and patient counseling plan for a patient receiving antihypertensives. WK is a 60-year-old male presenting with edema of the right lower extremity. He is a patient that smoked 1 pack per day and quit in 1996. He reports having about 4 drinks of alcohol per week. He is currently not regularly exercising, and he reports a recent change as of 2 months ago in the prescription of levothyroxine from 75 micrograms to 100 micrograms. He also reports discontinuing bisoprolol without his physician's consultation. His chief complaint today is he has swelling of his right leg. He has a past medical history of high blood pressure, high cholesterol, and hypothyroidism. He has a family history of high blood pressure, diabetes, and high cholesterol. He has no past surgical history. He has a social history as a former smoker, smoked 1 pack per day, reports quitting in 1996. He reports consuming 4 drinks of alcohol per week. He's married with 3 children and is currently still employed, and he has no known allergies to date.
The medications that WK is on include bisoprolol 2.5 milligrams. He takes that for hypertension, and he takes that every morning. He started 2012, and he has no stop date. The doctor who prescribed this medication is Dr. Kadir, and the special instructions for this medication is do not stop taking without consulting the physician. And he's also on valsartan and hydrochlorothiazide combination, 80 milligrams / 12.5 milligrams. He takes these for hypertension as well. He takes it every morning. He started taking this medication in 2012, and there's no special instructions on this medication. He's also on levothyroxine, 100 micrograms. Takes these for hypothyroid every morning. He started it in 2012, which was increased to 100 micrograms as of 2 months ago, and he has no special instructions, and he has no stop date for that medication. He's also taking acetaminophen 650 milligrams by mouth for headaches and pain as needed, and he started taking this medication back in 2013. He's also taking a multivitamin, which is a supplement, every morning by mouth. Started in February of 2000, and he takes this over the counter, and there's no special instructions on it. The review of system for WK include thyroid problems, high blood pressure, swelling of the right leg. We do not have a physical exam for him. We don't have any laboratory data or diagnostic tests. The problem list for WK include non-compliance, patient reported discontinuing his bisoprolol without consulting the physician. We would rate this as a high priority. Swelling of the right leg, patient reported discontinuation of bisoprolol without consulting the physician. We would rate this also as a high. He has elevated blood pressure, which is 148/90. We would also rate this as a high priority. Inappropriate dosage, patient prescribed 100 micrograms which was increased from 75 micrograms. Patient reported not feeling well, and he began taking 75 micrograms instead of 100 micrograms. We would rate this as a medium priority. Then he has missing drug therapy. We would recommend aspirin 81 milligrams, which is a low priority.
We have concluded that WK's primary problem is hypertension. Subjectively, the patient reports feeling fatigued. He has a sedentary lifestyle. He drinks about 4 drinks per week, and he reports swelling of the right leg. The patient also states medication makes him feel awful. Objectively, we have seen swelling of the right leg and an elevated blood pressure of 148/90. The assessment of WK is that he is a 60-year-old male presenting with edema of the right lower extremity. The patient reports a change in prescription of levothyroxine from 75 micrograms to 100 micrograms as of 2 months ago. The patient also reports discontinuing his bisoprolol without physician consultation. The plan of action is for goals of therapy to reach and maintain blood pressure goal of less than 140 over less than 80, reduce the swelling of his right leg, maintain a low sodium diet, maintain compliance with medication regimen, and prolong life.
The pharmacologic plan that we have for WK include continue his bisoprolol 2.5 milligrams by mouth daily in the morning. We recommend that he starts taking an aspirin 81 milligrams by mouth daily. We also recommend ibuprofen 400 milligrams by mouth every 6 hours as needed for inflammation or pain. The non-pharmacologic plan that we have for WK is regular exercise, 30 minutes daily as tolerated, elevate the right leg, wear some stockings to help with the edema, apply ice to the right leg, low sodium diet, and we encourage that he rests his leg to help with the edema. The monitoring parameters for efficacy include evaluate the swelling of the right leg in 1 week to assess reduction of the swelling, to evaluate his blood pressure in 2 weeks to assess for decrease in blood pressure, to monitor his A1C every 3 months, and also we want to monitor his TSH, T3, and T4 every 4 to 6 months. To monitor for toxicity and adverse effects, we would recommend monitoring the TSH, T3, and T4 every 4 to 6 months. We also would recommend that he consults his doctor if he's experiencing any unusual side effects before he discontinues any of his medications. For the follow-up on his medications, we want to recommend that he schedules a follow-up visit with a physician in a month. For patient education, we have a medication-related action plan for WK, which is take bisoprolol 2.5 milligrams by mouth daily in the morning to control blood pressure, to take the hydrochlorothiazide valsartan combination by mouth, which is 80 milligrams / 12.5 milligrams daily in the morning to control the blood pressure, take levothyroxine 100 micrograms by mouth daily in the morning, and also consult with a physician if he's experiencing any side effects before he discontinues his medications. We also recommend a low sodium diet and exercise daily or as tolerated. WK will schedule an appointment with his pharmacist on 8/5/2014 at 1 p.m. for a follow-up.
Thank you.
Thank you.